Good evening, everyone, and a very warm welcome to the pilot episode of the Specialist Journey. My name is Suparna Maharaj, and I will be your host for this evening. A very special welcome to all our medical students, from first years right through to final years, and to our interns joining us from across the country. It is so great to have you here. Tonight, we're kicking things off by focusing on internal medicine, a field that forms the foundation of so many others, and one that requires both a depth of knowledge and a love for problem solving. We're very lucky to have an incredible guest with us who has walked this path himself and will be sharing his story, insights, and advice with us tonight. It's my absolute pleasure to introduce our guest speaker for this evening, Dr. Dane Perumal. Dr. Perumal is a consultant in internal medicine at the Victoria Mxenge Hospital. Some of our third and fourth year students may have already been taught by him during their rotations there. Before we hand over to him, let me just give you a quick snapshot of Dr. Dane Perumal. He's a first-generation medical professional who studied right here at the Nelson R. Mandela School of Medicine, graduating summa cum laude, top of his class with multiple academic awards. On the screen, you can see a long list of impressive achievements from his mid-school successes to his fellowship and Master of Medicine. But there's more to doctor than just medicine. He is also a keen reader and a thinker with a deep interest in politics, philosophy, history, and the arts. He loves cycling, rugby, and the outdoors, and has recently taken up the clarinet. Above all, his personal philosophy is centered around curiosity, critical thinking, lifelong learning, and compassionate service. It's these qualities that truly define him both as a doctor and as a person. We will now hand over to our guest speaker. Just one point before that to our attendees. Please feel free to send any questions through on the chat during the talk. Dr. Perumal will be happy to answer them during the Q&A at the end. Handing over to Dr. Perumal. Good evening, Dr. Perumal. Thank you for joining us this evening. It's such a pleasure to have you here with us this evening. I'll now hand over the mic to you. The floor is yours.
We can see your screen now, Doctor.
You can, okay. Okay, so let's start with my disclosures. These are my professional affiliations and my prior conference funding. The aim of this talk is to basically give an overview of what it takes to train in internal medicine, but also to give you some of my personal anecdotes of the journey to becoming a consultant. We'll try and keep it informal, and hopefully we'll have time for discussion at the end. So what is internal medicine? This is sometimes a difficult question to answer. I'm often confused for a GP or a family physician, and it's especially by those that don't work in the medical field. I'd like to think that I'm something like Dr. House, at least a small percentage of the time, but I think most of the time I end up being like Dr. Doolittle. The best way to describe internal medicine to the general public is to use the example of a pediatrician. So just as a pediatrician is a specialist in the care of kids, I am a specialist in the care of adults. But really, internal medicine spans a large depth of care, concerning itself with the prevention, diagnosis, and treatment of both acute and chronic conditions. We see patients in the inpatient and outpatient setting and aim to give them a holistic, comprehensive care. We tend to see multimorbidity and complex pathology. These patients are often referred to us by family physicians or by general practitioners, and we also see a large contingent of patients ranging from adolescents to geriatrics. One of the beauties of internal medicine is its breadth. We see that there are many subspecialties that one can go into after qualifying in internal medicine. And this is truly one of the beauties, that You can build a great life for yourself as a specialist physician working in either public or private, or you can choose to pursue further training. For example, my interest is in cardiology, which is a further 3 years that one needs to train after acquiring the FCP. And then you become a specialist subspecialist cardiologist. So I'm often asked the question, why internal medicine? And it's often a question that's asked in a registrar interview. And as much as this is maybe an overdone diagram, the Japanese concept of ikigai lends itself to my passion for medicine. So I was fortunate enough to train under many brilliant physicians as a student and as an intern, which really forged my love for the profession. I found out early that I was good at it. I enjoyed diagnostics. I enjoyed clinical work. And it's the niche. As with many specialties in South Africa, the doctor-patient ratio is far too large, and there's definitely scope for additional positions. And of course, you can build a good life from it. Those intersecting spheres is one of the main reasons why internal medicine is my career of choice. So Suparna has spoken about this already, but just a snapshot of my journey. I was the last group of the 5-year curriculum at UKZN's med school and graduated in 2013. I then served my internship at Khan Hospital, which is the community that I grew up in Chatsworth. I returned back to do my community service at Khan Hospital. I spent 11 months in internal medicine, and I gained enough experience during that time to add it to my CV, but also completed my part 1 of the fellowship and presented at Grand Round, UKZN's Grand Round, and made Grand Round finals. I think it was that plus my undergrad results that managed to get me a reg post straight out of ComServe. And I served as a registrar over those 4 years. This was also during COVID, and went back to RK Khan as a consultant in 2021 and joined VMH last year in Jan, hoping to pursue a more academic career. So we're going to discuss a little bit about the nitty-gritty before I give my personal anecdotes. And I think since the largest group on this chat are medical students, the pre-reg training may be of more interest here. So the first thing that I can recommend is to really take your undergraduate training seriously. I think medicine as a whole is a demanding career that requires a great degree of diligence, but internal medicine in particular is a specialty that demands it even more. So use your in-ward training purposefully. Spend time at the patient's bedside, spend time learning from those who are willing to teach, and engage with the literature even outside your lectures. In years gone by, having the FCP Part 1, which is an exam that focuses around basic sciences and its clinical application. It's offered by the College of Medicine of South Africa and costs about 12,000 to write. The first opportunity that one has to write this is in community service. Previously, it was thought to be a nice to have when applying for a reg post, but now it's almost certainly a prerequisite. You then can consider developing your CV, and it starts with medicine experience. So working in an internal medicine department, especially if it's going to be an academic one. And in KZN, one of the other prerequisites is that you have rural medicine experience. Diplomas in internal medicine and HIV management are considered particularly advantageous, and these are also offered by the CMSA. Additional courses that one can do include advanced cardiac life support and medical emergency courses that are run by various different organizations. And you can also go for courses that develop particular skills such as ultrasound or echocardiography skills. An important aspect of specialist training is research and research development. And gaining experience in research is particularly important. For example, WITS has a complex scoring system that is used to pick out the best candidates for their reg training. And up to 15 out of the 100 points that they offer is available for first author publications. So that's something definitely to get involved in. I think UKZN students are particularly at an advantage, and that's specifically because not only do we have many really good clinician scientists who publish frequently, but we are also attached to both DDMRI and KRIT, and they are at the forefront of TB and HIV research. They often take on students who are interested in being part of projects and help develop research skills there. Visibility in the workspace and especially in the academic setting is important. So presenting at conferences, presenting at academic meetings, being present at academic meetings is important. I've definitely noticed an uptick in the amount of undergrad students that attend postgraduate meetings, and that's always encouraging to see. The application process, once you've completed your community service and have experience and meet the prerequisites for a reg post, follows a typical human resource process. The adverts are put out publicly, typically on Department of Health Science per province, and one applies using a form called a Z83 form, which can be accessible via online or via a human resources department. You send in your supporting document shortlisting. The process of shortlisting involves many different components, including management, academic staff, and HR, and is a closed door process. The interview process, which can be quite daunting and can go by in a tick, has a diverse panel. It's usually a larger panel than you would for most other jobs. And this panel consists of academic staff, senior management, internal medicine and non-internal medicine staff, and representatives from human resources. The questions are wide-ranging, and they could be on clinical management of cases, on human resource aspects such as conflict resolution, how you develop your research, and part of the interview is to gauge the candidate's mindset as to whether they would manage a rigorous training program. So once that process is done, there's one of two things that happens. You're either going to be unsuccessful or successful. So I'll draw your attention to the Titan Sisyphus, whose eternal punishment was to push a large boulder up a steep hill. And once he got it to the top, the boulder rolled down and he started the process again. And I want you to bear him in mind because sometimes the task of trying to get a reg post can feel like Sisyphean. But Albert Camus, a philosopher, says that we must imagine Sisyphus happy in the effort of getting an interview or taking the step to put yourself out there to get a reg post, and then to think about it practically. So ask for feedback and go back to the drawing board, bolster your CV. And this is if you're unsuccessful. If you're successful, that's great. You need to prepare well, to understand the outputs that are required, and to ensure that the thoughts of these outputs are paired with time outline goals. So I got in as a reg immediately post ComServe. I think I was quite excited. I was fresh. I was quite proud of myself. And I probably thought I looked like, one of these residents. But this is probably what I look more like on my first day. bright-eyed, bushy-tailed, very eager, a brain full of knowledge, but really quite a junior in all of this. Reg time taught me a lot and aged me a lot, I think, as well. So Reg training is a 4-year program. It's rigorous. You rotate usually every 3 months through general medicine, which is usually at the hospitals in the Durban circuit, but there are satellite sites in both Potchefstroom Hospital and Pietermaritzburg has its own training center. And also in the subspecialties, most of them are based at Albert Luthuli, but there's hematology and infectious diseases based at VMH. I found Reg time to be a steep learning curve, where previously I was an enthusiastic ComServe that was excelling at my job. I now became a Reg who was expected to know things, do things, understand things, and this was often before anyone had even taught to you. It was demanding, so long hours, lots of calls, lots of balancing of academics, clinical work, trying to get research done as well. But the learning was great. So the skills development was exceptional. The opportunity to learn was a great privilege. And here you can see a pic of a couple of us in Cape Town playing around in the V&A in one of the large exhibits there. We had gone to the World Congress of Internal Medicine in 2018. This was when I was a second year reg. And a lot of the doctors in this pic are currently practicing in state and are excellent doctors, actually pushing the best for patients. I think the one thing to remember is that you must be prepared for curveballs. One such curveball was having to practice medicine, having to prep for exams while being in the midst of the COVID-19 pandemic. I remember we were senior regs at the time, so we were often used to see patients, make decisions, work in high-risk zones like ICU and high care settings. And this was all while prepping for exams. So it does take mental nerve to do both. But there's an old quote that I often tell my registrars, and that in reg time, the days are long, but the years are short. So you blink and years go by. And 4 years, which sounds like a long time, is really sometimes not enough to get all of the skills that you need. So once you've finished at least 30 months of reg training, you are eligible to write a Part 2 exam. The Part 2 exam consists of multiple papers, a clinical exam, and an OSCE. It in itself is a mountain to climb, but very much doable. You complete your master's in medicine and you join consultancy life, which has many benefits. So I always imagined consultants living an easy life, a really nice life. And as a consultant, I can say that it's true. We do have a good life, and I think that's when we're comparing it to the arduous task of being a registrar. With that said, it is a high pressure job and it can be demanding, and that's largely because you're responsible for many juniors working under you. You're responsible for the care of patients and the decisions that are made. You're answerable to senior management, your head of department, to the Provincial Department of Health. But most importantly, you are the person that has to train the conscience of the team as well. There's lots of administrative work, lots of paperwork. Everything needs documentation. There's often tons of meetings. But I think the fact that we get more free time, that we get to do our calls from home, these are really good trade-offs. I think one of the reasons that people choose to become physicians is because you can really have a good work-life balance. And we'll talk about balance a little later on. I think in the 4.5 years that I've been doing this job, I've only had to go out once at night, and that was largely voluntarily. So it's much different to other specialities such as pediatrics or surgical discipline where consultants may go out more often. The beauty of internal medicine is that, especially when you work at an academic department, there's the prospect of lifelong teaching and learning. I see it as a privilege to get to interact with students, to teach them, to be their tutor, but also to train the next batch of physicians to be a tutor to registrars that are in our system. It can be a very financially rewarding job as well. We have lots of physicians who opt for a hybrid work of both public and private, and they build really good lives for themselves. So one of the questions that I got asked as part of this talk was what I wish I knew earlier. I think when I look back, one thing that took me a while to realize was that reg time isn't medical school. So med school is this deeply focused, spoon-fed environment where there's dedicated time for academics and learning and very little responsibility. But reg time is all of the responsibility, none of the dedicated learning time, and a lot more checkboxes that need to be ticked. I'd say that having a good mentor is vital in the research sphere. I think as an undergrad with almost no research experience, it took a while to wrap my head around research. I think you want someone who is going to be present, who's going to be empathetic and amiable, but also going to hold you to a high standard so that you learn the skills, learn the critical thinking, and produce excellence. One thing is that life at times travels faster than you want it to. So I know most reggers will tell you how quickly reg time goes by. And it's important to realize that whilst reg time is 4 years of your life, other aspects of your life will demand attention. And here's where balance comes in. I believe that balance is a myth. If I look at my life as a reg or even now, externally, someone would audit it and say that it was very balanced. I took care of my physical and mental health. I studied, spent time in hospital, tried to do a good job with my work. But I know that I had phasic work, so there were times where I flat out enjoyed myself. I went on holiday, I traveled, I took time off, I enjoyed my weekends, I enjoyed my family, friends, I engaged in deep interpersonal relationships. But in addition to that, there were times where I saw no one. Like a month before my exam, I did not go out. I studied all the time. It was it was a it was a trade-off, and hence I say balance is a myth. There's a time for work and there's a time for play, and they often are not on the same are not at the same time. If I had to take over the training program for registrars in internal medicine and probably in other disciplines as well, one of the things that I'd advocate is for better guarding of one's mental and physical health. I think that having a checkpoint system or a check-in system with registrars is important because the toll of 4 years of training can be great, and this can result in burnout very easily. So I think that all academic centers should have burnout monitors as part of their training programs. So just a few final words. I'm trying to keep this talk brief. I think the one important thing to note, whether you're a reg or not yet, is that failing and adversity are actually good. when things are nice and easy and everything goes your way, there's very little character development, skills development that happens. Failing and adversity helps build resilience, and it's resilience that's the best antidote to burnout. If you want to become a physician, curiosity is key. I think that part of the clinical acumen that one needs to have is to be able to question things. So whether it's the results, whether it's the history of a patient, and students who I teach or who I've taught before will know that I'm critical when it comes to history taking, clinical examination, doing the basics right, because curiosity and an excellent foundation are the building blocks of a great physician. Soft skills are power skills. So because internal medicine is a bedside discipline, having good interpersonal relationships with your patients, with your allied health staff, with those that work under you are exceptionally important. You need to understand that you're often in a position of power and need to bring out the best in those that are working under you. And it's those soft skills that are actually the skills that make or break a physician when it comes to modern healthcare. It's important to understand that specialization and even the route to becoming a registrar, to getting the opportunities to specialize, is a marathon and not a sprint. It should be treated as such. Stamina is very important. Ensuring that you take time to rest and refuel is important. And you should always have in mind that a good physician balances evidence-based principles, intuition, and patient care, because when you put patients at the center of what you're doing, that's when you get the best results for both you and the teams that work under you. So just going back to me on my first day of work, my first day as a reg, I don't think that I thought about it that much, but in doing this presentation, I was forced to. My dreams probably started around here. So I'm three, flanked by two of the people I love the most. And in doing this presentation, I realized that becoming a doctor was one dream, but becoming a physician and then further having dreams, to possibly do a PhD, to go on to do cardiology, and then even train further after that. These are dreams that are so far and so distant and so removed from the spheres that my parents grew up in. They both have no tertiary education. That wasn't even on the cards for them. They had a lot of responsibility early on. And I'm grateful to say that my family, those that have worked with me, those that have trained me, have definitely contributed greatly to who I am. So this little Dane is 3 here, and 27 years later, he gets to graduate with those same people by his side with a few additions as a physician at the age of 30. So my parting shot is to say that all dreams are possible. And I think the fact that you've spent time on a Monday evening to sit and listen to me speak means that you've got serious considerations for your future. And I wish you well. And I also hope that we can add more physicians to our body. Thank you.
Thank you so much, Dr. Perumal, for such an engaging and inspiring talk. We are all truly appreciate the time you've taken to share your journey and your perspective with us. It's incredibly inspiring to hear directly from someone who's walked the path so many of us are only still imagining. This was a much needed reminder that specializing isn't some distant goal, but a real achievable journey with its own challenges and rewards. And I'm sure everyone here is leaving with something valuable to take forward. Thank you for that. We've also received some great questions from students through our registration form, and I think you've already touched on quite a few of them along the way, but there are a couple more that we'd love to go through now. So our first question is, There's often a belief that doctors can't actually choose their specialty. Is that true? How much say do we really have in the field we end up in?
Thanks for that question. I actually, I'm not sure if you can hear me, Suparna.
Yeah, we can hear you.
Okay. So I actually think that that used to be the thinking back in the day. So a lot of the time, if we look at our profs and some of the older academics, they were told where to specialize, or there were limited options for them. But I think that as a as a modern student, as a modern doctor, there's really a ton of opportunity, and you can definitely choose your path.
Okay, thank you for that. Okay, so the second question we've got is, considering the current high unemployment rate among doctors, how has this affected the process of specializing in South Africa? Does unemployment make it harder to enter registrar posts, or is the process more dependent on funding and CMSA registration?
Yeah, I think that's a really good question as well, and it's very topical now. So I had a snapshot of my timeline, and I was, I think, one of the last few people to get in straight out of ComServe. In that year, the registrar intake was around 10 regis, so I was really lucky to get in. It was also at a time where there was a moratorium on posts, so a lot of my friends were left without jobs after their ComServe. I think the current economic climate and the current management of the departments of health across the board, this is from national down, have resulted in far less or far fewer posts than we'd like for training. But I also think that we may get to a stage where people need to be a bit creative with how they do their training. So I know there's lots of institutions that allow supernumerary registrars to join. So basically, these are self-funded. I know there were recent adverts that went out for the Department of Plastic Surgery, for example. So there are ways to get around the fact that sometimes there are no posts.
Okay, thank you. So the third question you've got from the registration form is, are there specific requirements for each specialty, or are the basic requirements generally the same for all?
So I think there are a couple basic requirements that are usual for all, and it's largely to do with experience. Um, as registrar posts have become more competitive, one of the additional requirements is that you pass at least some diploma or some part one in the specific discipline. But most of these requirements are listed on the adverts that come out. So if you want, I can share with you some of the prerequisites for places like WITS and UCT and KZ and UKZN, and people can access them.
Sorry, I think that would be great. You can maybe send that to Asma, and then we'll circulate that around to everyone.
Yeah, perfect.
Okay. And then our last question from the form is, are there any textbooks, study materials, or online resources you'd recommend for interns or community service doctors who want to start building a strong foundation in internal medicine early on?
I think this could be used for students as well, because any student who's worked under me knows that the first book that I tell people to read is Tally Clinical Methods. It's the foundation. So being able to examine a patient is the starting point. The prescribed textbook for internal medicine training is Harrison's Principles of Internal Medicine. It's a thick, intimidating book. I remember looking at it as a student at med school and actually being a bit intimidated by it. But I can tell you that I have read almost all of it. So in terms of what ComServes and interns can use, I think what needs to happen more than reading a specific textbook is the shift in how one interacts with with the information that's relevant to your patients. So in med school, students largely use lecture notes or videos. But if you want to become a physician, you should be interacting with the scientific evidence that really guides how we manage patients. So getting used to reading guidelines, critically appraising trials, keeping abreast of modern research, those would be more important than any specific book. Often the books lag in terms of the current data because things are changing so rapidly.
Thank you for that. So we're now going to move on to our chat. So before we begin,
sorry, before we move on to the chat, I see Sidra has her hand up for
yes, I can see that now too.
So I'm just going to unmute her. Sidra. Sidra, you can unmute. Okay, I think that was a mistake. We can move on to the questions in the chat.
Okay, I do see that Sidra did put a question in the chat anyway, so we will come to that. I think she may be a bit shy to unmute, which is fine. Before we begin, someone did put in the chat when you said med school is spoon feeding time. They find it unbelievable because I'm sure most of us can relate that we feel ourselves drowning a little bit now, but that's a side note before we begin with the questions. Okay, so the first question, someone asked, what was your research topic for MMed and what inspired you to research in that topic, considering internal medicine is a broad specialty?
So I did my master's with Prof. Matala and Dr. Piri in the Department of Endocrinology. My topic was looking at dysglycemia in HIV positive patients and the interplay that HIV and antiretroviral therapy, the interplay that takes place. The previous research, though they limited in quality, showed that antiretroviral therapy was associated with an increased risk, especially if of dysglycemia, especially if there was intercurrent protease inhibitor use. But my research, which was a sub-analysis of the Durban diabetes study, actually found contrary evidence to that. So I think in terms of why did I choose diabetes? So apart from cardiology, one of the interests that I do have is infectious diseases and metabolic diseases. So that was a good intersection.
Thank you. Sorry, that question was first from Wanele. So we're now going to move on to Jade Naidu. So they say, hi, Dr. Perumal, wonderful talk, very insightful as I'm very interested in doing internal medicine. I'm currently doing my Masters of Science with Prof. Naidu. In terms of other research, what other projects would you suggest to do specifically during community service to get at least a medical officer post?
Hi, Jade. That's lovely to hear. So I think apart from doing your master's, you can also look at possibly getting other papers out. So even if it's a case report, in terms of additional projects, if you can during your ComServe year, get signed out to do a diploma in HIV management. So basically get time in a center that treats HIV, or if you're going to be working with an internal medicine department, even if it's going to be spending time in a satellite site, to get experience in internal medicine, to do a diploma in internal medicine is also something worth trying. Community service can also be very demanding because often you're sent to under-resourced and rural areas, and sometimes clinical service is taking most of your time. So I think doing your MSc is a great start. That holds you in good stead.
Okay, thank you for that. We have another. So the question from Sidra says, "Good evening, doctor. Thank you for your insightful talk. As a fourth year, I want to please ask if we are not part of Caprisa and are interested in research, is it too late to commence?"
So I think that's a good question. So, I'll address the concept of too late first. So it's never too late to do anything, firstly, especially in medicine where there's always a way to get things done. Um, you don't necessarily need to be doing research through Caprisa. There's multiple different academic spheres that are all publishing research. So, for example, um, there's Prof. Singaram who also does a lot of research, and I know many people who've done their masters with her. So if you find UKZN academics that are publishing, they probably have ideas that you could latch on to or that you could augment to use as a research topic. So you needn't necessarily go to Caprisa or KRIT. This can always be done at UKZN, like similar to how Jade has approached Prof. Naidu.
Thank you for that. I personally have a question. If anyone else has questions, you're more than welcome to send it on the chat. You got summa cum laude and you came top of your class when you were in medical school. What was some of the ways that you kept yourself not sane, but you were consistent with your work all the time without being distracted or um, being overwhelmed by the amount of work that med school usually puts us through?
So I think that's a good question. When I teach third years and fourth years, at some point we probably have a discussion about this, and you know don't don't bite my head off, but I think that the time is relatively the same. So the time that you have and the time that I had is the same, but it's just that I think current students, modern students tend to have a lot more on their plate. So they're involved in many more things, and they are more distractors. I think I was pretty focused on med school. I think when I started in first year, asked myself, what do I want? What are the steps to achieving it? So they were time-based goals, but I also set out what my non-negotiables were. So, if my non-negotiable was that I'm going to ensure that I go to dissecting hall every session that I'm scheduled for, even if I haven't read or even if I didn't feel like it. Um, that would be the hard that I would choose as opposed to having my hard be a difficult exam. So I think some discipline is important. And if you don't have it, because I can tell you now, as someone who, as a consultant, you tend to do what you want, read what you want. There isn't this incredible pressure that there is like on students or registrars. I tend to, I've lost a bit of my discipline, but you need to find ways to develop discipline, I think, especially in medicine. I think in med school, I also felt that I was very privileged to be there. I felt like I needed to prove myself. And I also felt like there was the weight of this degree that hung heavy on my shoulders. So I think there was a fair bit of being serious about it, and specifically trying to achieve certain things.
Thank you for that. Oh, I see Alok has put another question in the chat. Good evening, doctor. Building on the above question, what would you suggest be the above question being, I think, Sidra's question. What would you suggest be the ideal time frame in which to commit to research in the journey to specializing?
So I think if you're doing it in the Reg program, you typically have 4 years to do it, or 3.5 years to do it. And the reason for that is because you're basically doing another degree concurrently with it. If you're doing a master's, or a more simple MSc part-time while you're working, that usually takes about 2 years to do. That's why choosing a really good supervisor as well will help you meet those time targets.
Thank you for that. I do have one more question, sorry. So someone did mention the unemployment thing, but maybe if you can remind everyone. I'm just going to re-ask the question. I typed it out. So there are many interns that apply for ML posts and later registrar posts. What can I do to stand out in the crowd and give myself the best chance of employment?
Okay, so maybe I'll answer it slightly different this time, because it's also pertaining to a medical officer post. I think one of the things to remember is that yes, whilst there's a fair bit that's within your control, for example, doing additional courses, doing your masters, writing your part ones and things like that, you do have to understand that there's other aspects that are taken into account. So, for example, there may be equity aspects. There may be small amounts, small intakes for the year. So not everything is within your control. I also think that, over the years, where medicine used to be pretty linear before, so, you either went into GP practice or you worked in a state hospital. There's people who have gone into non-clinical work, who've gone into corporate work. So sometimes a small deviation from what your typical plan may be necessary to keep yourself alive, financially. For a reg post though, the aim would be to get into an internal medicine department, because time away from an internal medicine department actually jeopardizes your chances of a reg post. I know in the Western Cape, one of the much frowned upon practices is that people are doing voluntary service as part of experience to basically say that they've gotten 12 to 24 months. I've got strong views that that shouldn't happen. But I know some people who financially they find it feasible to do such. So, if that's you, then that's great. But the other thing that students can do, or early career doctors, is join union organizations. Get your unions to cry foul of the fact that we don't have enough posts available for everyone, and it's that pressure put on the Department of Health that actually does get things moving a little better.
Thank you. I think that is now the end of all of our questions. So in conclusion, thank you once again, Dr. Perumal, for sharing your time, experience, and wisdom with us tonight. You've taken something that can feel really overwhelming, which is specializing, and make it much clearer, more manageable, and truly motivating. All of us today are leaving the session with a better sense of direction and a bit more excitement for what lies ahead. Thank you once again. We really appreciate it. It's been a privilege to hear from you and to learn from your journey. To all our attendees, thank you for being a part of the pilot episode of the Specialist Journey. We hope that tonight has given you a clearer picture of what the path to specialization looks like, and even a bit of inspiration for your own journey. Before we close, someone that was very crucial in the planning of this webinar, Asma, would like to just say a few words.
Thank you, Suparna. Firstly, I just want to thank Suparna for leading this session smoothly. Also, a big thank you to all the students and interns that interacted with our Google form, sent through questions, and also interacted with our chat today and sent through questions. And last but not least, Dr. Perumal, a huge thank you to you for sharing your journey with us. And I personally found this very informative. And I think I can confidently say that everyone here is definitely leaving with a lot to think about. a lot of motivation as well, and also a lot of inspiration. So thank you so much for your time. We really appreciate it.
Thank you, guys. And thanks for the opportunity to speak. I'm actually surprised to see that there were close to, I think, 100 people on this call. So that's actually really nice to see that there's this type of student involvement as well.
I also think it's because you have created a good name for yourself, so people are very inclined to listen to you as well. So thank you once again, everybody, and Dr. Perumal for joining us this evening. We wish you all the best for all of your future journeys, whether that's completing medical school or internship and community service, and of course for Dr. Perumal in your journey, hopefully through to cardiology. That's it from us for tonight. Thank you again and have a good evening, everyone. Goodbye.
Thank you, everyone. Bye.